5 things you should know about back labor from a high-risk labor and delivery nurse who has also experienced it. Not fun. Back labor refers to intense pain and discomfort that can occur in the lower spine during labor. There's the pain of the contraction in the front, the pain in the back happening at the same time. The back pain may go away as the contraction passes, or it may linger a little bit even between contractions. Number 2, back labor does not happen every time somebody goes into labor. In fact, it only occurs about 15 to 32% of the time. In most cases, it's going to linger throughout most of the labor, and when it comes time to push, only about 5 to 8% of these people who had back labor will continue to experience it during the pushing. Number 3, back labor is most likely caused by the baby's position during the labor process. There's a lot more to baby's position during labor than just being head down. When the baby is head down and the baby is in a position where he's kind of looking at your spine. This position is called occiput anterior. Occiput is what we call the back of your baby's head. Anterior means facing forward. In most cases, this position is the easiest way for the body to dilate, fit through that pubic bone, and eventually birth the baby. Sometimes the baby likes to look towards your belly button and not at your spine. This position is called OP, or occiput posterior. Some people also refer to this as sunny side up. Current evidence shows us that OP, or sunny side up, seems to be the cause for most back labor. The back of the baby's head is pressing against the tailbone in that lower spine during the squeezing of the contractions, which is causing that pain and discomfort. Number 4, most people explain that back labor feels very painful, equally as painful as their contractions. Intensity and discomfort increases as the labor progresses. It can feel like sharp nerve pain, deep aching in that lower spine, quite similar to having a back spasm. Very low on your spine, usually right about here. And number 5, there are ways to relieve back labor. My number 1 technique as a nurse and as a patient is utilizing position changes. Anything that's going to lift the weight of your baby off of your spine. What that often looks like is using the bed or a chair and leaning forward like this. This is going to lift the baby's weight off of your spine, and there's not going to be as much head compression against your spine. We can also do lunges or hands and knees. I love to utilize a birthing ball. There are a million more. One of my favorite resources is something called spinningbabies.com, and it's all about utilizing position changes to help rotate your baby in a more ideal position. Heat is another really great tool, and we want to apply it right to that lower back. Counter pressure directly where it hurts on the back is another great tool. You use this part of their palm, and also use massage balls. Press directly on their lower spine. Just hold it there, or you can do small, deep circles. Another good tool for hip squeezes. You can apply a lot of pressure on the hips throughout the course of the contraction. There's also TENS units, medication, epidurals, bathtub, shower, so many other ways we can manage this pain. But for my own patients, if it's safe and my patient is up for it, I like to encourage the position changes, rotating the baby out of that sunny side up